Left side body pain causes and treatment. Common causes of pain on the left side of the body include infection and injury to muscles, nerves, or internal organs such as the heart, spleen, left lung or kidney, pancreas, and more. It is best to contact a doctor for an accurate diagnosis. They may perform a physical examination and order tests to confirm the cause of pain on the left side of the body and advise on suitable treatments. In some cases, this pain resolves on its own. However, other cases may require immediate medical intervention. Enlarged or damaged spleen. The spleen is an organ in the upper left of a person's abdomen. It is an important part of the immune system, though people can live without one. People may experience pain on their left side when the spleen is injured or enlarged. Damaged or ruptured spleen. A ruptured spleen is a medical emergency. An injury is the most common cause of a ruptured spleen. The rupture can occur immediately or weeks after the initial injury. Symptoms can include pain behind the left ribs, tenderness, dizziness, rapid heart rate. People may also feel pain at the top of their left shoulder if they lie down and raise their legs. Enlarged spleen. According to the United Kingdom's National Health Service, an enlarged spleen can occur due to injury, infection, or an underlying health condition such as rheumatoid arthritis, leukemia, or cirrhosis. People may not always experience symptoms. However, if symptoms occur, they may include discomfort and pain behind the left ribs, bleeding easily, anemia, fatigue, feeling full quickly, infections. Treatment may involve addressing the underlying cause. In some cases, surgery may be necessary. Diverticulitis. Diverticulosis is a condition wherein small pouches form and push through the weaker spots in the colon wall. Diverticulitis occurs when one or more of these pouches become inflamed. The National Institute of Diabetes and Digestive and Kidney Diseases notes that the pain or cramping typically occurs in the lower left side of the abdomen. The pain may be sudden and severe or mild and worsen over a few days. Other symptoms may include diarrhea, constipation, fever, nausea and vomiting, chills, blood in the stool. Treatment. If the symptoms are mild, a doctor may recommend home management, including pain medication and a liquid diet. Some people may require antibiotics. If symptoms are sudden and severe, people may need hospital treatment, such as intravenous antibiotics or surgery. Heart attack. A heart attack occurs when something blocks an artery supplying blood to the heart. This blockage is often due to a buildup of fatty deposits in the arteries. Pain in one or both arms may be a symptom of a heart attack, but other important symptoms to look for include discomfort in the left or center of the chest, a feeling of squeezing pain or pressure in the arms, chest, or both, shortness of breath, cold sweat, lightheadedness, nausea. The American Heart Association advises calling for emergency services or the nearest hospital if these symptoms occur. It is vital to seek treatment as quick as possible. Treatment. Treatment for a heart attack may include surgery, medications, or a combination of the two. Doctors may also recommend lifestyle changes. Sciatica. Sciatica typically affects one side of the body. When it affects both sides, doctors call it bilateral sciatica. The most common cause of sciatica is a herniated or bulging spinal disc, which puts pressure on the sciatic nerve. The sciatic nerve extends from the spine to the legs and feet. People with sciatica sometimes define the pain as knife-like or a feeling of pins and needles. Other symptoms may include numbness, sharp pain when sneezing or coughing, and inability to sit up straight, weakness, a burning sensation around the buttocks. To diagnose sciatica, a doctor will perform a physical exam, discuss the person's symptoms, and may order imaging tests. Treatment: sciatica typically improves on its own with a few weeks. However, a doctor may recommend rest, over-the-counter pain relief, stretching, or physical therapy. Gas in the digestive tract. A buildup of gas in the colon can cause pain on the left side of the body. The pain can also occur on the right side or on both sides. People usually pass gas through burping or passing it through the rectum. This is a routine process of the body. Sometimes gas accumulates in the digestive tract from swallowing excess air while eating or drinking. It can also accumulate due to the breakdown of undigested foods by intestinal bacteria. Foods that can cause excess gas include carbonated beverages, sugar substitutes, and fiber supplements. Other symptoms include frequent belching, flatulence, abdominal bloating. Treatment: management may involve changes to diet and lifestyle, such as avoiding fizzy drinks or trigger foods. If someone has painful gas, a doctor may also recommend over-the-counter medications that aid digestion. A sprain or strain. People can experience a strain or sprain on the left side of their body, as well as other body parts. Although people may use these terms interchangeably, strains and sprains are distinct conditions that can affect different parts of the body. The National Health Services suggests it is likely to be a strain or sprain if the pain and other symptoms affect any of the following body parts: ankle, wrist, foot, thumb, knee, leg, back. Sprain. A sprain is the stretching or tearing of a ligament, which is the elastic tissue connecting one bone to another. Symptoms of a sprain may include pain, bruising, inflammation, and inability to use the joint. Strain. A strain is an injury to a muscle or tendon. It can involve twisting, pulling, or tearing the muscle or tendon. Symptoms may include intense pain, muscle spasm, muscle weakness, swelling, cramping, difficulty moving. Treatment. The American Academy of Orthopedic Surgeons recommends the RICE method for sprains and strains, which involves rest, ice, compression, elevation. People may also benefit from gentle exercises and over-the-counter pain relief. Ovarian cyst rupture. A ruptured ovarian cyst can cause severe pain that typically occurs on one side of the body. An ovarian cyst is a fluid-filled sac that can develop inside or on an ovary. These cysts are common and usually harmless. Ovarian cyst can rupture. In some cases, they do not cause any symptoms or may cause mild symptoms. In other cases, they can cause severe symptoms, such as sudden and severe pain in the lower abdomen. Bleeding can also occur. Treatment. For mildest symptoms, a healthcare professional may prescribe pain medications. In more severe cases, people may need surgery. Testicular torsion. Testicular torsion typically causes sudden pain on one side of the body. Testicular torsion occurs when the testicle rotates. This can twist the spermatic cord, which brings blood to the scrotum. As a result, the reduced blood flow can cause pain and swelling. Symptoms may include sudden and severe pain in the affected testicle, nausea, vomiting, abdominal pain, groin pain, a swollen testicle. Treatment. Testicular torsion is a medical emergency. If a person does not receive treatment within 6 hours, their testicle can shrink and die. They will need to undergo surgery. Kidney infection. A kidney infection can cause pain on either or both sides of the body. The kidneys are below the rib cage or either side of the spine. They perform many vital tasks, including filtering the blood, ridding the body of toxic waste, controlling blood pressure, maintaining fluid levels. A kidney infection disrupts these vital functions. It typically occurs due to bacteria. Most kidney infections begin as a bladder infection. Symptoms may include pain in the back, the side, or the groin region, fever, nausea and vomiting, cloudy or dark urine with an unpleasant smell, an increased need to urinate frequently, painful urination, chills. Untreated kidney infections can lead to a life-threatening condition called sepsis. As many as 6 million people die from sepsis every year. Treatment. A doctor will prescribe antibiotics and likely intravenous fluids to treat a kidney infection. When to contact a doctor? If someone experiences any symptoms of a heart attack, they need urgent medical attention. People should also seek medical attention as soon as possible if they have symptoms of the following: a kidney infection, testicular torsion, diverticulitis, injured spleen. All of the above can lead to severe or life-threatening complications if a person does not seek treatment. In general, people can benefit from speaking with a doctor if their pain does not improve with home treatment or disrupts daily life. Depending on a person's symptoms and medical history, a doctor may recommend seeing a specialist for a more thorough investigation.